So one thing that's become very clear today is we really need that focus beyond 2020 from government. So we'll have seen that progress is being made, but actually there's so many more things we need to do to bring those benefits to patients. And one thing we've heard a lot about today is diagnosis and people having delays with diagnosis. But one thing we're seeing from the scientific evidence is actually treatments are likely to be most effective at the really earliest stages of disease. So how can we make sure people are being diagnosed at those really early stages to be able to benefit from treatments in the future, get involved in research now, but also they know their diagnosis, they know what they're living with. So we need to make sure that when we do see effective treatments come through, and it's a matter of when and not if, that those treatments get to patients as quickly as possible. We've recently done some modelling in our report, Thinking Differently, and that's shown that the cost of dementia treatments are going to put a huge pressure on the healthcare system, and we really need to prepare now for those future treatments. So Alzheimer's Research UK has launched a Dementia Access Taskforce looking at how we address some of those challenges. So how can we look at making sure everybody is aware that dementia starts, well, Alzheimer's disease starts many years before the actual clinical symptoms that we associate with dementia occurs. How can we make sure we look at new funding models so people will get access to those treatments as quickly as possible? And we're looking at those and a number of other challenges through our task force to come up with those recommendations so that the healthcare system will be ready for future treatments. Today has shown how important it is to engage with service users. I mean, just some of the stories we've heard today, and Susie on the panel I was on, it's really powerful. It shows you, it brings back how that policy matters and shows what is making a difference on the ground, where we need to do more, and those things that really matter to people living with dementia day in, day out. One of my main takeaways today is the passion in the room. Everyone is so passionate about seeing change happen. Yes, there's a lot of discussion about progress and having evidence of progress, because everyone in the room is so passionate that we do change outcomes and do improve the lives of people with dementia, and that's what I'll take away from today.